one, just like a pulling of the fibers over there. Now we have worked with the kinesiology taping, icing, but once the swelling goes down a little bit, the pain goes down a little bit, I can start the PNF approach right away. So the first approach which we are going to use today is dynamic reversal. Now this is an approach in which we are going to build the concentric contraction for the agonist and antagonist. So that means I'm going to work with inversion and then I'm going to work with the eversion movement. So agonist and antagonist together without relaxation in between. So we are not going to ask her to relax at all without the loss of muscle tension. It's a continuous firing of the muscles over there. Now because we know if we go for extreme inversion, and is that the painful? Yeah. So there she is feeling. You can just see the response over there. Let me know. That is the painful. So there she has the pain. So we're gonna start from the eversion here, and we're gonna go up to this painful movement only. We're not gonna push her after the pain. So we're gonna work within the pain limit. Okay. From here, we're gonna go for the eversion. I'm going to get my one hand with the lumbrical grip under the toes, and I'm going to get another hand with the lumbrical grip over the toes. I'm going to ask her now to down and in, and then go and up. Down and in, up and out. Down and in, and up and out. Down and in, and up and out. And see, I'm not pushing her after the painful. Up and out, down and in, up and out, down and in, up and out, and it's a continuous. I'm not allowing her to relax at all. After this, the second thing I'm going to do is the combination of isotonics, which is the technique of the PNF, in which we're going to work with concentric, static and eccentric contraction for agonist group of muscle. So I want this movement. Okay, I want is to facilitate this movement, which is the ankle inversion. Of course, not after the pain. So I'm gonna use is my fingers under the toes. I'm gonna ask you to now push it down and stay there now. Now this is static contraction. The first one was concentric contraction, and now I'm going to push you up, and you're going to resist but lesser, not too much, so that I can go up against. So then allow me to bring it up, allow me to bring it up, allow me to bring it up, and now you push down. Stay at this position and allow me to bring it up. And down, stay, allow me to bring it up. So ideally, of course, we use the lumbrical grip, but as a modification, I'm going to use my thigh for the same. And I'm going to ask her now to push down. Stay. Now is the steady contraction, and let me win. And then push down. Stay, and let me win. And just relax. And that gives the immediate results as a feeling a more stability. So we just done one repetition of the dynamic reversal and combination of isotonics. You can still ask her to stand, just sit up and stand, and just feel the stability. Feel better with the stability? So of course we need to repeat that, but that's what gives you the stability and the feeling of the movement facilitation. Okay. So one for the dynamic reversal, which is for the agonist and antagonist, concentric contraction, and the second one was the combination of isotonics. We also call it in the short form as a COI, in which we're going to work with the concentric, static and eccentric contraction for agonist group of muscles over there. Okay, and then of course some soft tissues over there, a little bit of gentle mobilization at the tail if she is okay with that. And then the TP.